So during the webinar, please enter your questions into the Q&A chat box at the bottom of your screen, and Lisa will do her best to address them. So without further ado, I will turn it over to Lisa.
Thank you so much, Erin. Hi, everyone. It's really nice to be here with you today, and we have a lot to cover, so we're going to dig right into the Families First Coronavirus Response Act. So we're going to talk about the sick leave provisions, family and medical leave provisions, how you're going to pay for this leave, as well as documentation, return to work, and exemptions from the law. Please also know that things are subject to change. They have changed many times to date. And so if you're listening to a recording of this webinar, please know that this information is current as of April 15th, 2020. I apologize in advance for the amount of content in these slides. People are starving for information right now, and so I know this will be a reference, and I simply want you to have the information. Typically, I wouldn't have this amount of verbiage on my slides. And so we have received hundreds of questions, and we'll address the most common ones throughout this presentation. And then, as Erin mentioned, we'll take your questions at the end, and please use that Q&A chat box in Zoom. And so the effective date of the Act is April 1st, 2020, and covered employers include private companies with fewer than 500 employees, and this includes nonprofit and religious organizations, and then public entities of all sizes. So this includes local and state governments, and in some cases, but not all, federal agencies. And so employees who have been with you for 1 day are eligible for this sick leave. Employees who have been with you for 30 days are eligible for the FMLA leave. And so the typical FMLA leave qualifying provisions, they don't apply here, that you have 50 employees, that the employee has been employed with your organization for 12 months. All of that goes out the window. So there is one qualifying reason for FMLA leave here, and that's that the employee has been with you for 30 days. And so what can this leave be used for? So this leave can be used if the employee is unable to work or telework due to any of the following 6 reasons. So the employee is subject to a federal, state, or local quarantine or isolation order related to coronavirus. Now, this isn't a shelter-in-place or stay-at-home order. This isn't when the government shuts down the state and allows only essential businesses to operate. And this isn't when you close your doors because you have no business. This means that the CDC or a local health department has told your employee that they have to stay at home because they are sick, and that's an isolation order, or because they've been exposed to someone who is sick, and that's a quarantine. So reason 2, the employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. So in this case, the employee has perhaps had a call or a televisit with their physician, and their doctor has said, yeah, your symptoms sound enough like COVID-19 that you should isolate. That's number 2. The third reason is that the employee is experiencing symptoms and they're working to get a medical diagnosis. So this means that they might be waiting on a visit or a call with their doctor, or even taking off of work for an appointment. Now, please note that if an employee has self-diagnosed himself or herself and has decided to isolate, but they've not sought a diagnosis or spoken with a physician, or they haven't been advised by a doctor, then that individual would not be eligible for this leave. Reason number 4, the employee is caring for an individual who is subject to an order as described in reasons 1 or 2. And this individual needs to be a reasonably close relationship with your employee. So this is generally going to be a family member. And so it can't be the nice lady down the street who waters your employee's plants when they go on vacation. Reason number 5 is the employee's caring for a son or daughter due to the child's school or child care closure due to COVID-19. And then reason number 6, the employee is experiencing any other substantially similar condition. And if you're wondering to yourself, what does that mean? Well, no one knows. And it seems to be a catch-all phrase. The DOL, the Department of Health and Human Services, hasn't provided any sort of guidance on this. So for the purpose of today, we'll be focusing primarily on reasons 1 through 5. And so here are the provisions of the Emergency Paid Sick Leave Act. So full-time employees get 80 hours or 2 weeks of leave, and the DOL defines full-time employees as individuals who are working 40 hours a week. So for the purposes of this leave, if you have an employee that works fewer than 40 hours, they are considered a part-time employee. Now, for part-time employees, they are going to get the number of hours that they work on average in a 2-week period. Now, if this number fluctuates widely, what you should do is take a 6-month look back and take an average. And then if the employee just started, use the number that was agreed upon at the time of hire. And then the amount of pay that your employee will receive is going to be dependent upon the reason for leave. So for reasons 1 to 3 that we discussed on the last slide, employees will receive their regular rate, but that's up to a cap, and that cap is $511 a day and $51.10 in the aggregate. Now for reasons 4 to 6, or I should say 4 to 5, employees will receive 2/3 of their regular rate of pay up to $200 a day or $2,000 in the aggregate. Now, if an employer chooses, they may be more generous than these leave caps, but if they are, they're not going to get an additional tax credit. And we'll talk a little bit about those tax credits in just a few minutes. You may allow your employees to use existing paid leave that they have to make them whole, but you may not require it in the case of EPSLA. Now, emergency family and medical leave is available for one reason only, and that's because your employee is unable to work or telework, and that's due to the need to care for a child under the age of 18 due to school or child care closure. Now, this does also include children over the age of 18 if they are disabled. Now, there is some contradictory information between the DOL and the IRS on the age of the child. So I'm hoping that some guidance will be issued soon. So this provision says age 18, but my interpretation is that if you have a kid who is 17 and it's summer break, and you usually wouldn't be taking care of them anyway, and so in this case, maybe it's summer break and they're not able to go to guitar camp because of COVID, and instead they're hanging around the house playing Minecraft, you know, this employee likely would not be eligible for leave because in theory, they should still be able to work. A 17-year-old does not necessarily need to be cared for. Now, I am sure the government is not for free-range children, but a 17-year-old and a 7-year-old is a completely different situation. Now, to confuse matters, the IRS guidance that has been provided says that if a child is older than 14 and it's during daylight hours and the child does not have special needs, then the employee should be able to work. So it seems like there is some reconciliation needed between the DOL and the IRS, that they're just not on the same page, but hopefully we'll get more guidance on that soon. So FMLA leave is unpaid for the first 10 days, but they can use any other leave to fill in, and that includes the EPSLA leave that we just discussed if it's not already been used. Now, after that, the remaining 10 weeks of leave is paid at 2/3 of the employee's regular rate of pay, up to $200 a day and $10,000 in the aggregate. And so given these caps, it's really not a great incentive for people who are fairly well paid. Now, like the EPSLA, if an employer chooses, they may be more generous than these leave caps. But again, if they are, they're not going to get an additional tax credit. Now, while the EFMLA, no, I should say with the EFMLA, unlike the EPSLA, you may require employees to use existing paid leave to supplement the 2/3 pay to make them whole, but you may not require them to use their sick leave for this purpose, only vacation or PTO. And that's because they're not sick. They're using the leave to care for a child. So let's talk about how you're going to pay for the leave. There will be an immediate dollar for dollar tax offset against payroll taxes. And so if you owe $8,000 in payroll taxes and you need to pay out $5,000 in this leave, you only need to send $3,000 to the IRS for those taxes. Now, if you pay out more in leave than you actually owe in taxes, the IRS is going to send you a refund, and I quote, as soon as possible. Now, I don't know what that means. I'd like to believe that it means in less than 2 weeks. Maybe it means 3 days, but I don't know. But you will get a refund. So at the end of the day, this does not come out of your bank account. It comes out of the IRS's bank account. And I encourage you to speak with your payroll provider on the logistics of holding back these taxes. They should be very well prepared for this at this point. So let's talk about the documentation requirements. So due to the need for support for the tax credits, you are required to obtain and retain documentation from employees for both of these leaves. Now, I don't recommend that you ask for a doctor's note. Right now, healthcare institutions are already so overburdened, and it is not a requirement of either the DOL or the IRS. And so here's what's needed for all FFCRA leave requests: the employee's name, the dates for which the leave is requested, a statement that the employee is unable to work or telework, and then for which qualifying reason, and that would be 1 through 5 or 1 through 6. And then as applicable, the employee must provide the name of the government entity that issued the quarantine or isolation order, either for the employee or the individual being cared for. The employee must provide the name of the healthcare provider who advised the employee or the individual being cared for to self-quarantine. The employee must also provide the name and age of the individual being cared for and the relationship to the employee. Now, for care of a child out of school or daycare, the employee needs to provide the name of the child or children being cared for, the name of the school or daycare that has closed, and then also representation that no other suitable person will be caring for the child at the same time that the employee is seeking leave. And then for care of a child older than 14 during daylight hours, a statement that special circumstances exist that require the employee to have to provide care to that child. Now, most of us are familiar with the FMLA reinstatement provisions that following FMLA leave, employees must be returned to the current or an equivalent role with equal pay and benefits. And the same applies here. However, if you have fewer than 25 employees, there is some leniency. And so in these cases, you must make reasonable effort to restore the employee to an equivalent position at the end of the leave. But if an equivalent position is not available, you simply must, for 12 months, you must make reasonable efforts to contact the employee should an equivalent position become available. And then regardless of your company size, whether you have 5 employees or 450 employees, FMLA has always provided that the reinstatement provision, it doesn't apply if business circumstances have changed. So for example, if the position is no longer available due to a job elimination or a business restructuring or the like. And so just to be clear, this act does not apply to stay-at-home orders. So these pay leave provisions only apply if the employee can't work for reasons 1 through 6, not due to a stay-at-home order, a safe-at-home order, or any order that closes a business or results in furloughs or layoffs. Now, as you may be aware, the new CARES Act greatly expanded unemployment benefits. And so in those cases of furlough, layoffs, even reductions in hours, please encourage your employees to file a claim with the state in those cases. Now, there are some exceptions that are permitted for both small employers and healthcare providers, as well as emergency responders. And so we're going to go into all of those in a little bit more detail. And so healthcare workers may be exempted from both of these leaves, both the paid sick and the FMLA leave. And it can be the whole organization or specific individuals. And I know this slide has a lot of words, and it's because this comes directly from the DOL. Now, this exemption is very broad. They have wrapped everyone who works in healthcare and everyone who contracts with healthcare into this exemption. So basically, these leaves are optional for healthcare workers. But if you work in a healthcare facility and you have an employee that appears to have COVID-19, I would personally strongly encourage you to provide them with this leave. I think that the intent of this exemption was to keep workers where we need them. I don't think that it was the IRS trying to avoid paying healthcare workers. They just want to give healthcare facilities the most leverage to stay open and have enough people to do the work. However, the DOL has provided this guidance, and I quote, to minimize the spread of the virus associated with COVID-19, the DOL encourages employers to be judicious when using this definition to exempt healthcare providers from the provisions of the FFCRA. So again, if you can, I would make every effort to provide healthcare workers with this leave. And all of this that we just discussed responds to first responders, which, as you would expect, is also a very broad definition. Now, there is also an exemption for small employers, but it is much more narrow. And so I want to be really clear here that just because you have fewer than 50 employees, you can't say, hey, I don't have to provide this leave, or I'm small, so I'm exempt. That is not how this functions. And so there are 3 circumstances in which you can exempt your whole company or certain individuals. However, before you exempt your whole company, I recommend that you look at these requests on a case-by-case basis. And so here are the exemptions. So the first one is if providing leave results in the financial obligations causing you to cease operating at a minimum capacity, you may be exempt. But given that you can take this right off the top of payroll taxes, probably one person taking this leave is not going to put you in this category. But if everyone in the company piles on and requests this leave, then it is possible that this first bullet would apply because you don't have the revenue and you can't wait for the IRS to send you the refund for the amount that you overpaid. And then paying this out could cause you to cease operating at a minimum level. And so in that case, you may be exempt. Exemption number 2 is if the absence would be a problem because an employee has specialized skills or knowledge or responsibilities, you can tell them that they don't get this leave. And so you can be specific to an employee. So if Jane in accounting is the only person who can run payroll, she's the only one who can cut a check or balance the books, then her absence could be a real problem for you. And so you can tell her, you can't get this childcare leave because you are too essential. And then the final exemption is if you do not have sufficient workers to get the work done at minimal capacity. Now, this is not full capacity or half capacity. I'm talking keeping the doors open capacity. So if you're a really small company and you have only 2 people who make the widgets that you sell and both are asking for leave at the same time, then we've probably hit bullet 3. And so overall, this is not a broad exemption. So be judicious in exempting yourself, and to do so, you simply opt yourself out. The DOL does not want you sending them any documentation. There's not an application, and you simply need to keep your own personal documentation and explanations as to why people are not offered the leave. And you need to do this in case you need to defend yourself in the future. If one of those individuals calls the wage and hour division and tries to sue you, and the DOL has been providing their telephone number on the mandatory poster, which you're required to give all of your employees. And so the DOL can come after you if they think you're wrongly denying a leave. So I just ask that you be careful in using any of these exemptions. And then also remember that the exemption is only for reason number 5, and that's child care leave. And so you must provide the E-PSLA leave for reasons 1, 2, 3, 4, or 6, regardless of how many employees you have. There is a very brief non-enforcement period. It's only through April 17th, which is in 2 days. Now, they called this a 30-day non-enforcement period, but they started it when the law was passed on March 18th. And so for the purposes of non-enforcement, an employer who has violated the law must have behaved reasonably and in good faith. And that means that all of the following need to be true. So you need to remedy your violation. If you fail to pay employees like you were supposed to prior to April 17th, you still have to pay them, and you need to make them whole as soon as possible. Do not delay. Second, the violations must not be willful. And so that basically means that you could have paid them, but you chose not to, like you did indeed have the funds, but just decided that you didn't want to do it or intentionally held off until April 18th. That would be a willful violation. And then finally, you must write a note to the DOL saying, we promise that we're going to do this right in the future. And so you have to do all of these things in order to not have the DOL bring enforcement against you. Bottom line, just try to comply with this right away, because not complying looks to be a bigger pain than just complying, and that non-enforcement period is very short. And so what else do you need to know? So both E-PSLA and E FMLA expire at the end of this year. That's on December 31st, 2020. And this leave is in addition to any leave entitlements already afforded your employees. And so if your employees are offered vacation leave, sick leave, PTO, if they're entitled for state leave programs, they are still entitled to all of those programs, and you also can't ask them to use those benefits first. And you also can't reduce your benefits. So don't mess with your own policies, don't mess with your own benefits. This is on top of whatever else the employee is already entitled to. You are not required to pay this leave out at termination. And then finally, I would like to point you to an excellent resource. So the Department of Labor has created a Q&A document, and it's been regularly updated. It started weeks ago with maybe 10 questions and 2 pages. Now it's up to maybe 20 pages and 80 questions. And it is really exceptional for helping interpret the many provisions of these laws. And so I would encourage you, I don't know that you can click on that link right there, so just Google FFCRA questions and answers, and it will be the first result that Google returns to you. Just note, however, unlike the CDC guidance, they've been identifying changes that they make. The DOL, they're not indicating when they make changes and what the changes are, and so I personally have been reading through this document every couple days just to ensure there hasn't been any additional clarification or additional guidance provided. Okay, so we have gotten hundreds of questions on these new leaves, and so here are the most common ones, and then we'll take yours. So the first question, what if an employee has already used or exhausted their FMLA allowance? Are they eligible for the new E FMLA? And the answer to that is no. So this new FMLA, it does not expand or extend the amount of FMLA leave that must be provided to employees. So if an employee has already exhausted their 12 weeks during the 12-month period, they would not be eligible for the leave. Now, if they have exhausted 6 weeks of their FMLA leave, they would be eligible for 6 weeks of this new E-FMLA leave. Now, be mindful that even in those cases, employees would be eligible for the 2 weeks of EPSLA leave. Are temporary, interim, or seasonal employees eligible for these leaves? And the answer to that is a resounding yes. Any employee that you have on your payroll is eligible for EPSLA and E FMLA. And so that includes full-time employees, part-time employees, interim employees, seasonal, temporary, intern employees, anyone on your payroll. Now remember, there is an eligibility requirement in terms of FMLA. They have to be on your payroll for 30 days, but an employee who's been with you for just 1 day is eligible for the EPSLA leave. If we are continuing to pay our staff now, even though our facility is closed, can we count this money toward the new paid leave requirements? So unfortunately, no good deed goes unpunished, and you're not permitted to use any leave that you've already paid out as a credit toward this leave. And in this specific example, the employee would not be eligible for the leave anyway, since they're not working or teleworking. Are employees who are on furlough eligible for EPSLA or E FMLA leave. So if your employees are on furlough, they are not working, they are not teleworking. In fact, they're not permitted to work if they're on furlough. And so while they wouldn't be eligible for this leave, they would be eligible for unemployment. And so I would encourage you to point them in the direction of their state unemployment office. Can E-PSLA be used on an intermittent basis? So the answer to this question is a little bit complicated. So if an employee is working on site with other employees, E-PSLA is not permitted to be used on an intermittent basis for reasons 1, 2, 3, 4, or 6. And that's because if this employee may have COVID-19 or is being exposed because they're caring for someone else, we don't want them coming in and leaving our workforce, leaving our workplace on a regular basis and potentially exposing others to the virus. Now, if the employee teleworks and both the employer and the employee agree, then EPSLA may be used on an intermittent basis for reasons 1, 2, 3, 4, or 6. Now, for reason 5, and that is caring for a child due to school or child care closure, whether the employee works on-site or remotely, EPSLA may be used intermittently, and that's if both the employer and the employee agree. And it should be noted that the DOL is encouraging as much collaboration as possible between employers and employees, just so mutual needs can be met and there's maximum flexibility for employees. Can E FMLA be used on an intermittent basis? And this is a much more simple response. And the answer is yes. If the employer and the employee agree, E FMLA may be used on an intermittent basis. And again, the DOL is just looking for both employees and employers to be as flexible as possible here. Is an employee entitled to EFMLA if their child's school is offering remote or online learning? Now, if the employee's child is participating in remote learning, even though they may be occupied, there still may be a need for childcare. And so, yes, the employee may be entitled to EFMLA in this situation. Is an employee entitled to E FMLA or EPSLA if we are offering remote work? And the answer to that is yes. So while an employee may be permitted and able to work from home, they might still have a need for childcare, or they might have a need to care for another individual who may have COVID. And so in that case, they would be unable to telework, and so that would make them eligible for the leave. If a company cuts pay before April 1st and employees subsequently become eligible for paid leave under PSLA or EFMLA, is the employee paid at their prior wage, salary, or their new wage or salary? And so your employee needs to be paid at the wage or salary that is in effect when the need for leave arises. And so if you have an employee and perhaps their leave, their pay, their wage or salary was cut on April 1st, and on April 17th, they have a need for leave, then it would be at that new wage or salary that is operative on that date, and that would be April 17th. Do I need to inform employees of the right to take paid leave? And the answer to this is yes, and the DOL has issued a poster and it must be provided to all of your employees. And you can simply download this from the internet, and it describes all of the requirements of the Families First Coronavirus Response Act. Now, typically, this would be, you would place this poster in a conspicuous location in your office, right? So this might be your break room or your kitchen where you place all of your labor posters. But because you have employees who may be teleworking, in the meantime, you should either mail or email this notice to your employees. And then in addition, if you have employees that are not working, so perhaps they've been furloughed, but they haven't been separated, so they're still receiving benefits, that means they're still considered an employee, then they also need to receive this notice. So this act it's a complex piece of legislation with a lot of requirements, and that notice provides a little bit of information, but not that much. And so I also recommend that you create a Q&A document to disseminate with this poster to your employees. And it will simply, it should distill the information, and that will make it easier for your employees to consume and digest. And ultimately, that will save you more time because they won't be coming to you with a lot of questions. Is all FMLA leave now paid? And the answer to that is no. So traditionally, FMLA leave has never been paid. It's simply job protection. And for all traditional purposes, that still holds true. And so only this new E FMLA is paid. And again, that's at the rate of 2/3 of the employee's pay, but subject to a cap of $200 a day and $10,000 in the aggregate.
All right, thank you so much, Lisa. That was an excellent explanation of the new legislation. I definitely learned a lot, and I hope everyone else did too. So next, Lisa is going to be taking questions from our attendees. So if you haven't already submitted a question, please feel free to do so now via the Q&A chat box at the bottom of your screen. We will try to get through as many of your questions as possible. So with that, Lisa, back to you.
All right, thank you so much, Erin. Okay, so it looks like we have a few questions here, and so we'll try and get through these, as many as we can, as quickly as possible. So the first question is there a good paid leave request form that is recommended to address the leave requirements under the Act? So I do not believe that the DOL has provided a leave request form. That being said, a good form is going to address all of those certification requirements that we talked about. So the employee's name, the dates that they're requesting the leave, the local government or agent, whatever agency issued a quarantine order, the name of the healthcare provider. And in fact, iHire, I think we have even perhaps developed one. So Erin, perhaps we can send that and follow up with the recording of this webinar. Okay, so if I have an employee who has been advised to stay home by a physician because they are high risk, is that covered through the EPSLA? And so that absolutely is. And so that would be covered by reason number 2. And so even though the employee perhaps doesn't have COVID-19, because they are in a high-risk group, it is common for healthcare providers to tell these individuals to self-quarantine. And the reason that they're eligible is because it's concerns related to COVID-19. So yes, they would absolutely be eligible for this leave. All right, next question. For clarity, if a healthcare provider advises an employee to self-quarantine, but the employee is able to work from home, then the employee is not eligible for EPSL, for the leave. And that's correct. So remember, all of these leaves, employees are eligible if they are unable to work or telework. So even though this employee has been advised to self-quarantine, I'm reading that you're giving this employee the ability to work from home. So that is correct. They would not be eligible for the leave. All right. What if the daycare is still open and the daycare is still open, but their parents don't want them around other children and prefer to keep them home? So this is a really good question. And so I would say, so first of all, we're talking about reason number 5 here. The employee is caring for a son or daughter due to the child's school or childcare closure due to coronavirus. And so in this case, the daycare is still open. So I do not think that this employee would be eligible for leave. Now, you know, there are some situations in which in which the employee could be eligible for leave here. If this is a child that might that might be high risk in other areas, they might want to speak to their doctor, and then that doctor might advise that child to be home from, well, actually, I take that back, because sorry, I'm just thinking this through. I actually do not think that it applies in this case. Okay. Can dental offices be exempted? I want to double check the DOL, but I do believe that dental offices are considered healthcare providers. Do we need to update our employee handbook to include this as a leave option, or should we create a separate policy to supplement the handbook that condenses this information for employees in addition to the poster? So there is so much going on right now. So in no way do I encourage you to update your employee handbook during this time. Yes, I have been advising most of my clients to create a separate and standalone and temporary, because remember, these leaves expire on December 31st. And so this is not something that you should put into your handbook, because it only is applicable for a very short period of time. So that's a great idea. In addition to the poster, distribute both your temporary policy and perhaps that Q&A that we discussed. How do you handle an employee that has been advised by their doctor, for example, that is immune compromised? Do they qualify for any of these extended benefits if they do have child care and are not sick now? Okay, so bear with me as I interpret this question. So in this case, I think a little bit more information is needed. So the employee has been advised by their doctor. Have they been advised by their doctor that they should not be around large groups of people? And if that's the case, that indeed would be reason number 2. That would be a doctor advising an employee to self-quarantine related to concerns about COVID-19. Will you provide a link to download the poster for our employees? I would be happy to, and Erin, perhaps we can send that in the link that we send of the recording.
Yeah, definitely. We'll look into including some links for a couple of the different things you've mentioned, Lisa.
Great. If an employee is on disability, do they also need to receive notice? So yes, you have an employee who's on disability. They are still employed with you, and so yes, indeed, they would need to receive this notice. If an employee is furloughed, why would they still be eligible for paid leave under the Act? If they are not eligible for the paid leave, why would they need to get the notification? Okay, so if an employee is furloughed, they are not eligible for this leave while they are furloughed. That being said, if they're furloughed, they are still an employee, and the requirement is that all employees receive this notification. And it's quite possible employers are doing furloughs in different ways. Sometimes they're asking employees to do rolling furloughs, you know, take 2 weeks here. Sometimes they're saying take a 4-week furlough. Sometimes it's indefinite. But you have to remember that this leave, this act goes through December 31st, and it's very possible that this employee comes back to work, and they need to be aware of these new laws. You mentioned a notice to be emailed to employees. Are you referring to the FFCRA notice? Yes, I believe so, but we will include a link that we send out with the recording. Can an employee take the 2 weeks of paid leave for exposure to COVID more than once? Technically, they could be exposed multiple times before December 31st arrives. Parvin, that's a great question. And so the employee is entitled to only 2 weeks or 80 hours of paid leave for any of those 6 reasons. And so no, they get 2 weeks in total. So for example, if your employee is taking 2 weeks of leave because they've been exposed, and then 6 months later, a family member is exposed, and that family member might need someone to care for them, they are not entitled to another 2 weeks of paid leave. The DOL poster, third bullet under paid leave entitlements, says up to 12 weeks of paid sick leave and E FMLA paid at 2/3 for qualifying reason number 5. You indicated earlier that the first 2 weeks are unpaid and the employee can take earned time. Which is it? So remember, there are 2 portions of this leave. There are 2 weeks of paid sick leave, and then there are 12 weeks of FMLA leave, but the first 2 weeks of FMLA leave is not paid. Only 10 weeks of the FMLA is paid. However, the employee can use those first 2 weeks, the sick leave, for those first 2 weeks of FMLA. So to be clear, there are only 12 total paid weeks of leave that any employee can earn. What if an employee has underlying conditions and does not want to work for fear of exposure to coronavirus? Would that employee qualify for emergency paid sick leave and emergency FMLA? If so, would that employee be paid at 2/3 of his or her hourly rate? Okay, so remember, in this case, FMLA does not apply. So FMLA is solely for the purpose of caring for one's child whose school or child care provider is not open. Now, this underlying condition, so in terms of this fear, I would recommend that this employee talk to their doctor, because this fear may or may not be reasonable. This is also something, ADA could also come into play here. And so it's something you may want to make an accommodation for. So this is a little bit of a complex question, and I'd certainly be happy to take this on offline with you, Elizabeth, and we can connect after the webinar on that. Would a high school intern be eligible for this leave? The high school he attends is closed. Our office is non-essential and closed to the public, and he is unable to telework. So in this case, this employee would not be eligible, because your office, it sounds like this employee is either on furlough or is unable to work or telework. Remember, this leave is only available to individuals who can't work or telework because of one of the 6 reasons that we gave. What if an employee can work half the day, but needs to do online school for the second half of the day? So this is a great question, and you may recall that FMLA leave can be used on an intermittent basis if both the employee and the employer agree. And so absolutely, that is permitted. That is your choice. And as I described before, the FMLA, the DOL would encourage that because they're looking for flexibility. As healthcare providers, do we need to document a response for not providing the leave? You mentioned small businesses do. Is it the same for healthcare providers? You know, I'll have to look. I don't recall seeing that in, you know, as I mentioned, this is a really broad exemption, and I don't recall seeing that in the Q&A. I think it's probably a good practice to document why you're exempting either your whole business or an employee. So even if it's not a requirement, I would encourage you to do so. Do you have a recommendation on if or how you would notify employees if you have an employee that tests positive? Sure. Well, and obviously outside the scope of today's discussion, but first of all, you do have some ADA obligations, and so you are not permitted to communicate who that employee is. And I would simply notify your employees that you have become aware that that one of your employees has tested positive, and then they should take whatever appropriate precautions. And if you go to the if you go to the CDC or encourage your employees to go to the CDC, they'll have additional information on that. And they might consider calling their physician. Some of this is going to depend upon how closely these employees work together, but you are not permitted to provide that information. So just simply let them know that you have an employee that has tested positive. Are veterinary offices exempt similar to dentists? I do not believe so. And again, let's take a look back at that slide, and we'll be sending you that deck. But I do not think that that would be considered a healthcare provider. What about employees, an employee who is self-quarantined because a family member has cancer and is in fear of infecting them when returning to work as she is taking care of cancer patients. In other words, she is choosing to stay away. So in this situation, this employee would not be eligible to take the leave. Now, this is an unprecedented situation that we're all living through here. And so to the extent that we can be flexible with our employees, I encourage you to do so. You know, is it possible for this employee to work from home? If this employee is not able to work from home, certainly I would urge you to, at a minimum, offer this employee the option of using their current leave, right? So I'm not talking about the EPSLA leave or the E FMLA leave, but whatever leave you're currently providing to your employees, but they would not be eligible for this leave that we're talking about right now. How about if someone doesn't want to go into work because they are scared to be around people? So this leave would not apply to them. Now, that being said, you know, you want to consider, is this a reasonable fear? You know, have a lot of people in the workplace had COVID? Remember, the general duty clause of OSHA does require that employers provide a safe work environment for their employees. And so this is probably, this is a question where a little bit more information is needed, and maybe we can give this employee a little more reassurance just through talking to them. And I think we are coming, up to right on the hour, Erin.
Yep, sure are. All right. Thanks again, everyone, so much for joining us for today's webinar. If we didn't get to your question, please keep an eye out for our follow-up communication. We'll address outstanding questions as well as provide an on-demand recording of the webinar. And my team will also look into providing links to a couple of the resources that we discussed during the live Q&A. All right. Thanks again, everyone, and have a great day.